So let's go ahead and get started on the history of hemochromatosis, the history of iron overload. So once upon a time in 1865 in France, there was an internist named Armand Trousseau. Now, he was operating on a 36-year-old male with documented diabetes, bronzing skin, and cirrhosis of the liver. So I believe that this was an autopsy, like this man had already passed. The diabetes had been a condition. I'm surprised that he was that old with diabetes, but as we'll come to find, there was a lot going on there. So it was noted that the liver of this man was compromised, right? So cirrhosis is a buildup of fibrotic tissue. It kind of hardens and dies and loses its function. So the man essentially was assumed he died of liver failure. Now, at the time, they were doing organ staining to kind of see what the status of the tissue was. And the dye that they were using is called Berlin blue or Prussian blue. It's actually called Prussian blue because it was also used to dye the uniforms of the Prussian army at the time. Completely unrelated. But they found that when used medically, it stained ill organs differently than others. So it was a means of identifying kind of tissue status at the time. They didn't know what it was showing, but it allowed for them to notice consistencies in the status of these sick people's tissues. So this particular man's liver stained very strongly, as did his pancreas and a few other of his internal visceral organs. Now, after this staining, this documented case of cirrhosis and diabetes and the yellowing of the skin, a few years after that, it was determined that the dye, the Prussian blue or Berlin blue dye, was actually indicative of iron content. It was iron that was causing this dye to pigment the tissues, the ill tissues, the way that they did. So 30 years after Trousseau, there is this Dr. Recklinghausen who actually took it upon himself to stain the livers of people with this termed bronze diabetes, right? Because that initial guy that Trousseau operated on had diabetes and the yellowing of the skin, which we now know is jaundice, which is a sign of liver failure. So bronze diabetes is a kind of an actual diagnosis. He stained the liver of this person with bronze diabetes, and it was found that the liver was unnaturally loaded with iron, as well as the pancreas. Okay? Recklinghausen was the first person to term the condition hemochromatosis. Okay? So, a little bit of backstory on what the liver does and kind of how we can delineate how what's happening is happening. So, the liver, and I've got a whole podcast episode on that, episode 9. The liver is a filter and a recycling center. Okay, so it's kind of like a waste management center, among other things. But it filters red blood cells. It stores iron and repurposes iron. And I mean, these ailments, these illnesses are indications of that, because jaundice, which is the yellowing of the skin, super associated with liver cirrhosis, alcoholism, things like that, it indicates that your liver is ineffectively filtering red blood cells. So bilirubin is a protein, a yellow protein that is a part of red blood cells. And because the liver is unable to effectively process and repurpose these red blood cells, which is its job, that pigment gets into circulation and tints the skin, tints the whites of the eyes, fingernails, what have you. And then hemochromatosis is the buildup of iron because, again, anything that's dealing with blood is also dealing with iron, but the liver processes red blood cells. And in doing that, it is separating the iron from the blood, sending it back to the bone marrow to be repurposed and recirculated via those new red blood cells. So, in an ineffective liver, the bilirubin, right, causing the bronze skin, and the iron from the ineffective iron storage or red blood cell recycling are what get backed up. Okay, so keep that in mind. Now, then the question was, well, why is this happening, right? So the initial theory, I think it was Recklinghausen who thought of this, was just internal bleeding, right? There is this blood that is not where it's supposed to be. It's kind of seeping into the tissues and breaking down, which is why iron and bilirubin, which are the blood components, were not where they were supposed to be. But then it was believed that diabetes caused hemochromatosis because of the common co-diagnosis. A lot of diabetics ended up developing cirrhosis and all of these liver complications, but that was kind of scrapped at the time because not all diabetics had the prototypical signs of hemochromatosis. So they just kind of let that fall where it lies. But then they tied it to liver cirrhosis and how they thought that iron overload or hemochromatosis was downstream of the calcification and the fibrosis buildup in the liver. Now, not all people with liver cirrhosis got iron overload and vice versa. So there were too many inconsistencies at the time for people to definitively say, yes, this is tied to this, yes, this is tied to this. But then came along Dr. Sheldon, okay? He's an Englishman, Joseph Sheldon. He did some extensive kind of long-term studies on hemochromatosis, and he noted possible heritability of the condition. It wasn't specific about how he arrived at this, but you would think that he was dealing with multi-generations, more than one person in a family, what have you. So he thought that it was some kind of heritable disease where a parent passed it on to their children. Now, again, gene theory isn't really a thing at this time just yet. It's getting there, but he was thinking that it was something that was passed from generation to generation. He also outlined how the misplacement of iron seemed to be so strongly correlated with this organ failure, whether it be your liver, whether it be the pancreas with diabetes. Now, diabetes and the pancreas were tied together in the 1920s by Dr. Banting. And so Sheldon was able to kind of connect those dots. Okay, lots of liver in the pancreas, lots of liver in the iron. Those lead to those organs failing. And the real question in all of this was, well, where was this iron coming from? So he was theorizing that small deposits of iron over a long period of time could lead to overload symptoms later in life. Sounds good to me. Now, this was largely not accepted at the time. So the genetic nature, again, he's a little bit ahead of his time in terms of gene theory. It didn't stick because nobody could really tell where the iron was coming from. where it's all coming, how does it get there, right? Why is there so much more iron in someone who has iron overload versus someone who doesn't? Interestingly enough, you also have to take into account the social setting. Now, because of that tie between liver cirrhosis and hemochromatosis, in conjunction with the fact that prohibition had just run its course in that time in America, alcohol was being demonized. And it was established that alcoholics frequently developed liver cirrhosis, right? So this was a perfect opportunity to villainize alcohol. So it was saying, well, if you drink alcohol, you're going to get cirrhosis of the liver, and that's going to give you hemochromatosis, right? So that was kind of the social narrative at the time, but there really wasn't any substantial evidence to, give that any creed. Now, Dr. Sheldon would be, his theory on the heritability of it all would be confirmed in 1996. Again, once the genetic revolution had already taken place, they actually isolated to a particular gene, the HFE gene. Now, we've talked about the HFE gene in a previous episode 8 on the genetic fallacy of diabetes.